and it says 253 cases are here in Uganda out of 100,000.
That's right.
To 253 cases. Now, previously, around 2015, we had a prevalence of 159 cases out of 100,000. So we'll about that gap that between 2015 and now, the rates have gone high. So there is a need for beating DP, DP, a lot of politics in my head, for beating tuberculosis. There is a very, very whole need. I'm going to be engaging our guest today. They understand so much more than me. You're very much welcome. Good morning.
Morning. Thank you for having me. So first of all, I would like to say I will start from where you came from. My name is Robert Nachibumbala, you've rightly put it.
Yes,
I am a public health expert, but a TB activist as well. And I'm chairing the marathon committee. We're going to have a run on the 20th of August, so we are less than a month away from now. But I'll start from where you started from. So TB, in Uganda, I want you to put it in absolute figures. Every passing day, TB kills 34 Ugandans. On a daily basis. That gives you a proper context. And Uganda is among 30 countries. They are called 30 high-burden countries. High-burden countries are the ones that contribute over 80%
of the TB prevalence. That is in the world.
In the world. And when we're in that league of 30 high-burden countries, it's not good news.
Yeah, it's not.
And also TB HIV co-infection, we are among those 30 countries. So it's a big problem in the country, and we have to pay attention to it. And it's between me and you and the viewer to ensure that we scale down TB and we end TB, because we have a target of ending TB by 2030. So that's the global outlook of ending TB. So I wanted to start from there. And then we can push on. And then I'll tell you that TB is an airborne disease, which, in other words, it's transmitted through the air. And I can transmit TB through talking, like I'm talking, through coughing, through laughing, through singing, and I dispense the droplets that have TB germ, and you also inhale, and you have TB.
No, just before the transmission from one person to another, what are those the symptoms that someone should be having? And I'm like, okay, I think I should get worried. I need to go for checkup. I need to get those symptoms that come in just before I even transmit it to anyone.
So you don't want to confuse people a lot with the TB terminologies, but pretty much all of us, I'll talk about it. But pretty much all of us who are living in sub-Saharan Africa, like Uganda, like any of these countries, have latent TB infection in our lungs. Latent meaning that we have an infection that we've been exposed to, but our immunity is fighting it, fighting off the disease. So, in other words, all of us are candidates of TB disease. When you get challenges, you get maybe say diabetes, you get HIV, you get anything that lowers your immunity, then TB disease can activate and it becomes a disease. But the signs and symptoms of TB, when you have active TB, we talk, the TB that we're talking about is active TB disease, which when you're coughing. Now, one of the signs is coughing. We say for more than 2 weeks, but any form of cough, you should go and get tested with TB. You lose weight, tremendous loss of weight. You lose appetite. You cannot eat. You get night sweats. You sweat, drenching night sweats. Amasuka negatoba. No, you wake up in the morning and say, my bed sheets got wet. It should concern you. So there are other signs and symptoms like swelling of the lymph nodes, you also have TB. So those are key signs and symptoms
so
of TB.
when someone gets that, you shouldn't take it lightly?
No, you don't take it lightly. We encourage you to go and get to a health facility. There are those health facilities that are from Health Center 3 onwards that do testing for TB, screening and testing for TB. So Health Center 3 is in every sub-county in Uganda, so you should be able to go there and get tested of TB.
Okay, talking about testing, is there some kind of counseling that they do when I go to test for TB? Because somehow TB is always related to HIV, which needs a lot of counseling and so on. When I go for these testings to these health centers or a hospital or a lab, are there some kind of counseling that I have to get?
So those are professional health workers that are there. The Ministry of Health has equipped the Center 3 with professional health workers, and there are constant workshops, trainings, and so those people will counsel you. They will not just say, yeah, just come, can you give us your sputum? No. They will counsel you and tell you what are the likely outcomes of the test, what it means. And that's, by the way, it takes me to the point that you're saying. So majority of our people at community level think that when you have TB, you also have HIV.
Yeah.
No, it's not the case. Although TB is the leading killer of people living with HIV, but you're not necessarily that when you have TB, you have HIV. No, the co-infection means the people who have TB and also have HIV, it has gone down below 50%. So in other words, it's about 35% right now. So in other words, out of 10 people that have TB, only 6 or so have HIV. So
actually that's what I was getting. What is the risk of someone who is having TB? What is the risk of getting HIV?
It is, I would say it's the other way around. The risk of having HIV and getting TB.
And getting TB?
Yeah, not having TB and getting HIV, because it's the other way around. Because when you have HIV, we know that it compromises your immunity. And when your immunity is compromised, you are prone to activating the TB infection that is in you, and you develop TB disease. And that's why TB is the leading killer of people living with HIV. And that's why Ministry of Health has put in place a policy. When you go to a health facility and you're HIV positive, they screen you and test you for TB. Straight away, and vice versa, because one shows you are very, very likely to get TB. And it's a very high risk when you have HIV to get TB because of the reasons that I've given. So when you also have TB, that's why they test you for HIV, because chances are that you could be having HIV. And that's why the TB has been activated. But the good news is that when you are tested of TB, you can get treated and you're cured. That's the biggest message for people at community level. We tell them that TB is curable. So despite the fact that you get TB, it brings you down, you cough, you lose weight, as long as you're put on treatment, after 2 weeks, you stop being infectious and you start the healing process. So treatment is there, short time, the 6 months, you're healed and you're good to go. Apart from when you get that other form of TB, which they call drug-resistant TB, which is more complicated TB. So over TB, gualise wemputu atayagala kuona.
So do you mean it has stages? Ngabonora antu omuntu cancer bichi TB nayo ina stages.
Kakati. So TB it doesn't have stages. They are for purposes of communication to the public. You either have drug susceptible TB or drug resistant TB. And also people have to know that TB can affect any part of the body. It can be TB of the bones, TB of the brain, TB of the lungs. So there are several forms of TB. The biggest form of TB that we concern ourselves with is the TB of the lungs, because when I have TB, all forms of TB ministry and partners are concerned about it. But the TB of the lungs is, when I have TB of the lungs that is not treated, I can pass it on to other people. And that is a very big danger at community level. That's why it takes us to the numbers that you started with of prevalence of TB.
Actually, now that gets me to the handling.
So before that, let me clear that the stages that you talked about of TB. So now, then there is that form of TB that responds to treatment of the one they call drug susceptible TB, the ones that can be treated using the first line antibiotics that exist in the country. And so that one's the one I said is easy. But when you mismanage treatment, that first line, that first line treatment, so the germ becomes resistant and you cannot treat it using that first line treatment. So you need now to go the one they call drug resistant TB. It's very expensive and very chaotic. The treatment has a lot of side effects, and so take it this way: if to treat drug susceptible TB, you can use $500. To treat drug resistant TB, you spend up to $2,500, and with a lot of huge impact on the human, on the body of the person who has gone through it. So that is why we encourage ourselves at community level. When you have cough, you feel you lost weight drastically, you are having night sweats, you better go and get tested of TB, so that you don't get to that level of. And also, when you start treatment, complete it. No matter how you feel after taking the initial drugs, you better complete it so that it doesn't develop into drug-resistant TB. I wanted to clarify on that. Okay.
Now, just before I jump onto the campaign that is on, that is going to happen on the 20th, I want to know the handling these people, because like you said, I can cough and transmit to someone and so many others. Now, how are these people talked to? How do they engage with the communities, the people they are staying with? Are they supposed to be isolated, which also brings some kind of stigma?
That's right. So that's a very good question. So we encourage people who are, so TB patients are people and need respect. Being a TB patient doesn't mean that you are isolated. It's about knowing what TB, how TB is transmitted. So if I know that TB is not transmitted through sharing of a cup, then I don't need to isolate that person. 2, if I know that TB is transmitted when a person is not treated, then I know that person is not supposed to be isolated. So there's a huge lack of awareness of TB disease and the forms of TB and how it's transmitted. That's what causes stigma. So you cannot say, I don't share cups with the person who has TB. I cannot move with them. The most important thing is you get those people as early as possible and start them on treatment. Like I said earlier, when somebody starts on TB treatment, 2 weeks, they stop being infectious. And they're like you and me. And so isolating TB patients is there, but at clinical level, when they've been observed to be in a certain stage, but it's not something that at community level, when you've started treatment, you're okay, and you don't have to segregate people that they don't share cups with you, chase away them out from the home. No. The science of TB is that if, for instance, if there are centimeters that if you're coughing from there and some centimeters away, I cannot get the TB. And so you can also, when you're in an enclosed place, we encourage people to cough through cough etiquette. You say you can cough through your
mask.
And you cover yourself when you're coughing. You don't just cough openly. you know.
But that would call for social distancing.
No, I don't say social distancing, but we're talking about cough etiquette. You know, I can be here, even if I don't have TB, and I start coughing and
Yeah, I do understand, but the other one is a special one. It's a special case.
Yeah.
Like you literally have to distance, yourself.
Yeah,
from the person.
in a way, but not the way that community thinks.
Okay.
Yeah. And that's why that lack of information is what has caused a lot of stigma, and even people fear to go for treatment.
Okay, now we get to the campaign that is on in a few minutes. I want to know when, where, do we have kids? I need that kind of information. Who is the contact person? Do we have a number that I can call and they deliver kits, or I'm supposed to go to a certain location? Yeah,
so Ministry of Health and Partners has organized a TB run. This is a marathon. So this is a marathon that happens annually. Last year we had one, and this year we are going to have another one on the 20th of August.
Okay.
We are doing that for two reasons. One, to raise awareness about TB disease, like what we are doing, to let people know that TB is real, and Uganda has a big challenge of TB, like we've said here. And it's our responsibility, mine and yours, to ensure that we fight TB. But also to raise resources. We want to raise money and build an MDR TB isolation ward in Iganga.
Okay.
Yeah. Why Iganga? Because Iganga is one of the treatment sites of MDR TB patients, but they don't have an isolation ward. So for this time around, we want to build an isolation ward in Iganga Hospital. And whatever resources that we are going to bring, and it may not be a one-off, and mobilize from other places and we build that isolation ward. So anybody who's going to contribute to that will be contributing to building an isolation ward in Iganga.
How are we contributing? Now we get to the kits.
So and the way we have organized it is that we can have kits. We are selling kits at 30,000. At different outlets, at Ministry of Health headquarters, at Uganda Stop TB Partnership, which is Mukwa's house. We are partnering with Carrefour shopping centers. We are also partnering with Akamwesi and all Ministry of Health, district health officers in all different districts in the country, taking lead in selling those kits. So. And then also Equity Bank, because we're working in partnership with Equity Bank. And the Equity Bank is helping us with also having it distributed at their different branches across the country. So that's where you can get those kits. And each kit costs 30,000 shillings. And then we are going to do that marathon from Ministry of Health headquarters in Wandegea and back to Ministry of Health headquarters. We are going to do 3 runs. We are going to do 21-kilometer run. We shall do 10-kilometer run and 5 kilometers. Those will include walkers. So I don't know which one you choose.
I can take the 21. I'll manage that one, the 21.
So 21, some distance. That's what qualifies it to be a marathon.
Do we have a contact person or maybe a number where I can call and get more details?
I am going to give you that number in a short while and details of how to get that kit. I'm going to give you in a short while. But we encourage each one of us to take part in that marathon, and we raise awareness. It looks so good when you come there because it's not only a run, but you have talks, people who are talking. And the guest of honor, I haven't talked about the guest of honor, is the Prime Minister of Uganda,
Right Honorable
Robina Nabanja, who is coming to be the chief runner. So it's such a huge opportunity for you to run alongside the Prime Minister.
The Premier, wow.
So that is that. And it's interesting, the people who, like you're saying, who keep calling in and finding out who is doing what, who is running, how are we doing, how can we join. it impresses me. So I'm going to get you the number in a second.
Actually, you need to get it because no muntu aliyo tulaba wano ku Baba TV yanditaze okufuna that number so that they get more details. But anyways, I want to encourage you, gwatali wano in Kampala, you can go to your district headquarters and to a DHOs.
Yes, yeah, district health officers.
Yeah, district health officers. Go to your DHO, you can get a kit. This cause, newoba toli wano ntogenda kuddukira wano in Kampala, it is for a good cause. As you're hearing, it's going to be happening in Kampala. Naye okuzimba kugenda beera iniganga.
Exactly.
So it is a whole thing that is going to benefit all of us. Newoba togenda kudduka, please support, buy that kit because you never know. And by the way, TB ne mubana mwali. Oyinza ogamba anzeyete binkwata. Ne mubana wali, as I was looking through the report, 36 cases per 100,000 population babeera baana bato. So you never know, anything can happen to child, to your child or anyone gye batambulira, and anywhere you can get the TB. So let's get up and fight for a healthy Uganda so that naffe mu records zino, mu reports zino tukendezaako.
So number tugifunye, number is 0. This is a toll free number.
Okay.
0800 220633. That's toll free number. But you can also call 0772 205 054. You can also call 0788 741 338.
Okay, nandi kusabye ozidde mu Luganda.
Ngenda zidda mu Luganda. Wadenga
Lusoga is also good actually. You can do the Lusoga.
0800 220 633. Your number tebakutola ku sente bwoba okubyeku. Twaba ni 0 musanvu musanvu 2 205 054 ya MTN indi. Kabiri waba ni 0 musanvu munana munana musanvu inandala 338.
Okay, niwe chairperson wa organizing committee,
right? Chairperson wa organizing committee tulibanji.
So we are talking to the right person. Gwe tuyina okusokera ku.
Kituufu.
Okay.
So bo kuba kwedwe number de togeireku oja kuba nti oja kufuna omuntu akuwa right information. Akukobera nti tulijja wano tujabagano tujalumuka tuti.
As you speak that, Mr. Robert womba ebigambo to malirize.
Nti so wakanti ndikuja tujalumuka tuti leta kino. So I would like to appeal to others. The contribution may not only be in terms of buying a kit. You can also contribute directly. Wakanti nze mukuzimba wodi ye Iganga ndikwenda atayo bukaire bubiri nze nga Kevin tuja kanti, and we shall get you recognized. We shall get you recognized by the minister, by the prime minister, that you've made a contribution towards that. Okay. You should also be around and put on the kit, and you look beautiful. What it looks like, it's really good. So all of us, all roads lead to Ministry of Health on the 20th.
Okay.
And you can get still, as I wind up, we still can get the kits from any Carrefour supermarkets, from Akamwesi, from Ministry of Health headquarters in Wandegea, from Uganda Stop TB Partnership at Mukwa's house, from we want also to have Baba as a contact. I want to talk to the marketing department and
definitely you will have the opportunity before you even get to management. You will have the opportunity because we want to be a part of this.
Oh, thank you so much. We look forward to having you. So it is our responsibility as Ugandans to first of all contribute to local resource mobilization and make build that isolation ward,
okay,
but also to raise awareness about TB
okay,
disease.
thanks Robert, thanks for coming through. We were like that so about TB. I am very much hopeful and things are going to get better, but I want to urge everyone, let's fight, let's run against TB for the good of Uganda, for a better Uganda. Program Ganga Mka echatambula kusawa isat hot cup at 9. We are going to be having the DP Vice President Honorable Mukasa Mbide agenda kubeera wano munaye ng'ayogera ku gye tuli about issues in DP. So keep on Ganga Mka on Baba Television Uganda. Good morning.
Thank you.